Good morning. Thanks for joining me on the Meg Ellison Show. I appreciate you tuning in. Joining me this morning from our great friends at Wisconsin Institute for Law and Liberty, Will Associate Counsel, Kara Tolliver. Good morning, Kara. How are you?
Hey, Meg. I'm great. How about you?
Well, we were just chatting about how nice it is that it's Friday.
Yes.
So
Absolutely.
yeah, I mean, we'll be even more of good cheer at about 5 o'clock on Friday. Well, or today, but it's going to be earlier for me because I get up so early. It's 5 a.m. When it's not so cheery, and then early afternoon is when I look forward to meeting Friday, where it brings me. So, well, let's talk about this. We were chatting off air about how so much of the I guess I would say this is DEI related. The DEI is embedded within our federal government. I'm sure it's also in our state government as well. But how Will has recently notified the Trump administration of and I think you put together a report, Roadmap to Equality Healthcare, which identifies over 50 U.S. Department of HHS programs and initiatives that mandate, permit, or promote discrimination on the basis of race in the public and private sectors. Oh my gosh! And it's and we can't blame Trump, but now that his administration has been made aware of it, we hope that swift action will be taken.
Right. Yeah. I mean, so our report includes 55 various different initiatives and programs, like you said, that sanction federal funding on the basis of race for numerous different health and health-related assistance measures. And these are all programs and initiatives that are found in our U.S. Code and given to HHS to implement. But most of these schemes set forth classic forms of prohibited governmental discrimination long held to violate the Constitution's guarantee of equality. And so in general, I would categorize these initiatives as purposed to achieve racial balancing in response to societal disparities. And they're directed in two main ways. The first category sort of gets at the government's efforts to racially balance the healthcare workforce, in which basically dozens of federally funded health-related education training grants, scholarships, loans, fellowships, and other assistance are all designed to focus on and recruit certain racial minorities to various medical field professions. And the second category is perhaps even more egregious and includes racial balancing aimed at evening out the scales of mortality and morbidity with respect to various health outcomes. So this is where the government is prioritizing certain health conditions for which it believes there are racial disparities, and then focusing assistance on such racial minority groups as opposed to simply providing care and support for all individuals who are at risk or plagued by serious health conditions or issues. And the examples of that go on and on. There are funding initiatives aimed to improve health outcomes for certain minorities with respect to obstetrics care. There's like a gazillion different obstetrics care initiatives, HIV, AIDS, cancer, drug and alcohol abuse, domestic violence, health insurance enrollment, and much, much more. So our findings are urging the administration to carefully investigate all of the identified HHS initiatives and immediately cease enforcement of all unconstitutional racial discrimination.
So how do you find out about, is it a whistleblower, or do you really have to do a deep dive to get, to discover
I did a deep dive, yeah.
Did. Thank you, Carol.
And this was probably not comprehensive. There are most certainly other statutes in the code, but this is what you pull when you search race-based action throughout the U.S. Code and in the context of the statutes that HHS is administering. And there are certainly, so that is at the statutory level, there are certainly probably regulations that are sort of in parity with the statutory provisions as well. The agency should have a little bit more control over some of the regulations that they have passed over the years and some of their enforcement on that. But ultimately, a lot of these things are rooted in statute. And so we really ultimately, at some point, also just need Congress to act, get this racial discrimination out of the U.S. Code, and stop passing laws that are unconstitutional and illegal. It's not that hard.
Well, what's frustrating is that this has been going on for years, so we're going to have to play catch up for years to come.
Yeah, I mean, that's exactly right. The problem with the government's attempts to implement this notion of racial balancing or racial parity in healthcare workforce and as to numerous health outcomes is very well established. There's really no excuse that we've had such a buildup of all of these statutes in our code. Racial balancing the population has been patently unconstitutional for a long time. And number two, the government has been long since forbidden from relying on generalized societal disparities to justify racially motivated action, like racial balancing. And it's really important to understand that these constitutional prohibitions exist in the first place because, at bottom, attempts to reduce racial disparities and ensure racial balance are based on illegitimate racial stereotypes in which individuals are treated as nothing more than the product of their race when determining who is in need of or entitled to educational training and opportunities, as well as patient-related care and assistance. So, yet we've seen the federal government itself have a very large hand in initiating and perpetuating the spread of unlawful racial stereotyping through unlawful race-based policies in healthcare and in just about every context, for that matter. We're gonna, at this point, it's more important than ever from the public sector to the private one. It's more important than ever for all of this unlawful federally funded racial discrimination to end.
So, when you present a presidential administration, the Trump administration, with something like this, how do you find the right person to direct it to so that you can be assured that it's going to be addressed swiftly?
Mm-hmm. Well, so Trump's executive orders, he's initiated several executive orders on equality right now, outlining his expectations for different agencies to stop enforcing racial discrimination and what have you. So this particular letter was directed to HHS as the administrator of health and healthcare-related statutes, as well as the Department of Justice, who has a role in enforcing our nation's laws, and OMB, the Office of Management and Budget, which has some role in funding and what have you. So it's a lot of, kind of looking at what was contained in the content of those executive orders, and also just having contacts in the administration and, relying on those folks. So we believe that HHS has been making some progress with respect to the listing of 55 race-based federal statutes that our report identifies, and that our report will be instructive for the agency as it continues to implement not only President Trump's executive orders on equality, but also the commands of the United States Constitution. His executive orders actually simply just enforce the constitutional law as is.
What's frustrating is, Trump has obviously issued many executive orders, but then we have these activist judges, federal judges, that are blocking these executive orders. And it seems like this never-ending game of, ping pong, tennis, pickleball, whatever, that it doesn't ever seem to end. And it's frustrating because I don't ever remember federal judges blocking the actions of Joe Biden in the last 4 years.
Well, Will was actually responsible for blocking a lot of Joe Biden's activities in the last 4 years. But yes, I think in general there is going to be a lot of legal ping pong on these more charged issues, and we've definitely seen that. That only goes so far. I think when you have an issue like this one, that it's actually Trump's executive orders on these things aren't making new law. They aren't implementing new requirements. They're just enforcing Supreme Court precedent that has been existing for a very long time and was recently reinforced a couple of years ago when the Supreme Court decided a case called Students of Fair Admission against the Harvard college. So, it's a bit harder to have that fight when there's, it's actually the law and the agency is just kind of trying to enforce that law. But yes, we will continue to see those challenges, no doubt. But in any event, I think that we've already seen some of these initiatives start to come down in some differing extents, and currently right now, as I mentioned, like a lot of these federally funded initiatives, I mean, they're implemented directly in the private sector, or directly in the public sector, but they're also, funneled down to private entities who then go on to implement these race-based policies in their organizations. And we've seen, federally funded academic medical centers and health entities increasingly implementing illegal policies based on illegitimate racial stereotyping. Will is all too familiar with that problem as we await 3 pending investigations against Cleveland Clinic, Cincinnati Children's Hospital, and Johns Hopkins University for their racially discriminatory patient and medical training programs. So, we will wait and see what the investigations from HHS yield for those institutions, but they've been pretty clear that they're going to be looking at health entities and academic medical centers very closely on their healthcare policies that are implementing race-based considerations and requirements.
It's got to be overwhelming in some respects for you to have to face something like this because, you said, the headline of your press release from yesterday, Will identifies 55 federal funding initiatives. And it's just kind of, I'm sure when you were doing this deep dive, you're like, oh, another one. And it's in some respects, it's got to be really frustrating that and discouraging in some in some manner that you have to push back against our government, despite the fact that Donald Trump has issued these executive orders that were supposed to make this stuff go away.
Yeah, actually, it's interesting you raise that point because this project kind of started out as a particular program that I was looking at for nursing. It's called the Nursing Workforce Diversity Program, and it's been around since 1998, and it's a program that generally is aimed at recruiting certain racial minorities to the nursing profession. And, I know that there was other ones out there because I have a healthcare background myself. I spent my first part of my career actually in the healthcare field. But I was only focusing on the nursing program, and I'm just, in doing that, I started encountering all of these other ones, and it's like, so, maybe we just widen our focus here, and, by the time, I got done widening that focus, I'm finding statutes that permit HHS to rely on race even in the context of assessing civil penalties for noncompliance against certain healthcare entities for, laws they may have violated in the context of, for example, nursing homes. But they're allowed to consider the racial population of the patients that they serve, meaning that HHS apparently views populations of different racial groups as a heavier burden, and so it can either lighten the load of a civil penalty against an organization or reduce it just based on the racial composition of patients that the organization is serving. So, I mean, this project, started out with kind of one discrete thing and quickly,
multiplied.
Yes. Almost exponentially.
Yeah,
But,
well, that's our federal government for you, right? I mean, at least the bureaucracies within our federal government, if they can get away with it, they will. And, I guess what's most troubling is that there are still many that live among us all over this country that don't have a problem at all with DEI policies. They don't have a problem excluding people based upon their skin color.
Yeah, and it's really unfortunate because these types of policies have been on the books for so long, and they've kind of just been ingrained into society. This proliferation of divisive identity politics, and it's sort of become like, first nature. We just see it, and it's like, oh yeah, it's been in our culture doing these types of things for a very long time, and it's one of those things that happens so much you don't even think about it after a while, but it's gotten particularly disruptive the longer that it's gone on. And, it's causing, when you're talking about these policies, particularly in the healthcare context, you might be talking about life and death. I mean, you're talking about using race-based considerations to select physicians and other medical healthcare providers. You're talking about using race to select prioritization for who is eligible for treatment or other assistance. Those types of decisions have serious consequences for real people, and you don't want to find yourself on the other end of a policy like that. And you might be. It doesn't matter what race you are. I mean, you could be a minority individual at the other end of that policy, who has to have a physician that was selected on the basis of these unfair racial requirements. That's not the best physician, and you may have an adverse outcome that may not have happened if we would just go to a system of looking at actual merit and need for things like medical educational training and health assistance. So, I think these are obviously basic notions that have been contained in our Constitution for a long time. These types of race-based considerations and policies have been illegal, and now we just need to enforce the law and stop making exceptions and excuses for why we're not going to do that.
I mean, and I guess if you just keep repeating over and over to someone who embraces DEI, you don't have a problem with excluding your fellow Americans because of their skin color? Because that's ultimately what this has been doing.
Right. I think that a lot of times people don't realize where these notions come from. Like at bottom, these affirmative action programs are based on, as I mentioned before, illegitimate racial stereotyping. You are looking at somebody's race and you are assuming a whole plethora of circumstances and you're making assumptions about them based on your race. You have no idea if they're quote-unquote disadvantaged. You have no idea about their experiences. You have no idea about their risk factors for health conditions. Just because you're a certain color doesn't generally mean that you are at more risk for a certain. There's a difference between a disparity, for example, and a risk condition. The two are not the same thing. Having a disparity in society is just an outcome. Whether or not a particular person that might be contained in a disparity group is at more risk than another person who's not in that disparity, that's a totally different question. But when you are just looking at race to assume that this person is going to be more at risk or more disadvantaged, you're just making assumptions on the basis of race, and that is called racial stereotyping, and it's been illegal for a long time. It's a very unfair way to treat people. It's a very demeaning way to treat people. It's very undignified, and it needs to stop.
Gosh, you are, I did not know this about you, that you were a nurse. So I don't know if I should call you nurse attorney or attorney nurse, but
I was actually a laboratory scientist,
oh,
but
even better distinction. So, well, that sort of makes sense. You're digging for information. You're looking for all the information and getting to the bottom of things. So, hey, thanks for joining me this morning, Kara. I appreciate it. Hope you have a wonderful weekend and you're able to relax and enjoy it.
you as well, Meg. Take care.
Thanks. You too. That was Will Associate Counsel, Wisconsin Institute for Law and Liberty, Kara Tolliver. And if you want more information about their organization, go out to will-law.org.